Job in writing questions, really diverse questions and really thoughtful questions. So thank you for doing the preparation work. If a specific question is not asked that you want answered, there'll be a time that you can ask that. Generally, the questions went into a few groups, so we have about 5 groupings of questions. There was a grouping related to Nclex. What did you study? What did you, where did you study, etc. So they'll talk about their Nclex experience. Then how did you get a job? All right, how did you start? When did you start? All kinds of things related to that. Licensing. All right, that's why we have people who are licensed in Connecticut and also Rhode Island, so you can understand the differences. Pointers for the new nurse, all right, when entering that med-surg floor, and hardest transition from a student to an RN. And then also self-care. Some of you asked about self-care too. So they fall into that kind of grouping. What was the first fact that you learned outside of nursing school? So kind of understanding, what it's like to be that nurse on the floor too. And again, if there's not a specific question asked that you really want asked, please feel free. Okay, we'll do that. So why don't you each introduce yourself, okay, and say the area where you're working, and we'll go from there. And why don't you also say if you've gone on for your BSN, or you're doing med-surg courses or additional CEUs, or what you're doing, okay?
My name's Sarah Kelly. I do home care for VNA of Southeastern Connecticut. We're associated with Yale. My area is Groton, knowing Groton Long Point. I see 6 to 8 patients a day. I'm currently enrolled for my BSN. Our job gives a really nice reimbursement. It's actually most places you go do, and they really encourage you and support you to go back for your BSN. My job has no time frame of when I need to get it. They don't make you get it. And when I started back up to school, when I signed up for the classes, and they'd see that it was like an assessment class, I was like, oh, I already know all that. I assess people all day long, and I actually learned a lot. So I encourage everybody, even if you can't do it right away, to go back. And most jobs that you have will help you do that and guide you.
Well, my name is Heather Standish, and I'm a nurse and paramedic. I'm also nursing director for Red Star and Harvard Hospital. We have 3 helicopters. We provide critical care transport throughout the state of Connecticut. We go to Massachusetts, Rhode Island. We have 3 helicopters, 3 different bases. It's a great job if anyone's interested in flight and critical care. I'd love to talk to you after. I'm very passionate. Even though I'm the nurse director, I still fly about once a week. I think it's really important to be out there. I've been flying for 12 years. I went on to school. I got my master's at the University of Hartford. And that's where we are. But I could talk to you till you're blue in the face about critical care, transport, and air medical.
My name is Casey St. John. I graduated in December of 2016. I work for the Department of Corrections, so I'm a state employee. I've been doing that actually for 7 years now. I'm graduating with my BSN this spring, and I just applied for nurse practitioner school, so that's what I'm doing, hopefully in the fall. So that's good.
And again, in the back, if you can't hear something, just raise your hand, so that'll be the cue to people talking. How's that?
My name is Made Lafontaine. I graduated last year, so fall 2017. I'm working at Western Hospital right now. I'm in a new grad program. I'm actually about to finish the new grad program in a week. And so I got hired upon being matriculated in a BSN program, and that's how they encourage us to do. So if you guys are interested in applying there, you have to do that. I am going to the University of Bridgeport, and I'm just taking my 2nd class right now. So it's been good. It's busy, but it's good. And I'm on the med search floor. That's it.
Hello, I'm Jamie. I graduated last summer. Last summer, sorry. I am a adolescent pediatric psych nurse at Natron. I work all units, both adult, but my focus is in pediatrics. I'm currently enrolled in a BSN program. The hopes to go to my EPRN in psych, and I'm currently also taking classes through work to get psych certified. I think that's all. Yeah.
That's great.
Really,
And
that's
then, Cassie, thank you.
And I'm Cassie. I graduated in May of 2018, so like I just graduated. I'm in the nurse residency program at Bacchus, and I am in the ED there, and it's a lot of fun. And I haven't yet started my BSN yet, but looking into options for that.
Okay. So you can see you have med-surg, Connecticut, Rhode Island, home care, specialty areas. I mean, flight nurse, we're lucky to have all that diversity, corrections, and then behavioral health. So all the areas where you start and where you may go to, right? So things to think about. They had tremendous questions on almost every list was Nclex. So can you talk a little bit about Nclex?
I took my LPN and I took my RN. This time around, UWorld was my #1 go-to. I found that it's the closest reference to the Nclex. It's actually harder to find than the Nclex. So I found that reading the rationales and doing those questions, even if you're scoring low, at least if you're reading the rationales as to why you're getting something wrong, you have a better understanding. I used ATI, the books that they gave us, but UWorld was pretty much my go-to. That's what I would focus on.
Was it expensive?
It wasn't, I don't think it was too bad. It was definitely worth the money.
I think that's about like $100.
Yeah, I don't think it was too much.
I used the Nclex
I used that one too. Some of us grouped together. We studied in a group and purchased it like together. The UWorld one, but UWorld definitely of all the other apps, phone apps or books that I used, probably was the closest, like she was saying. And read your rationales. Don't just see that the answer's wrong or right and then move forward. And even if you keep reading the same rationale over and over again, it really helps you to eliminate answers from other questions you might not know the answer to.
And reading those rationales will really help because I would say more than half of the questions that I got on the Nclex were select all that apply, which we all hate those. They're awful. You can't eliminate anything. You get one thing wrong, the whole thing's wrong. But that is, there's a lot of those on the Nclex. So make sure you know your rationales.
The Nclex Mastery app I loved because it had like red, yellow, green with the questions. So like if you got a question that was yellow, you could like put it aside in your yellow zone and like go back to that. And what I didn't realize when I graduated was that there is no relief the day after you get pinned. Like no relief, like immediately you're trying to study for your Nclex. And I had an interview with this job the day after I graduated nursing school, and it was all pending on whether I passed my Nclex. So there was no relief, there was no calm, but I had to pace myself, and I don't do study groups. I don't do anything with other people. I was really awful at lectures. I don't think anybody thought I was ever going to pass nursing school because I was always in the back distracted, not paying attention to anything. So I had to find something that worked for me, and with that I could take an hour and a half every day or a set number of questions, like 150 questions, and go through them. And if I knew them all in the green, awesome, I never have to look at them again if I was like positive I knew them. And then you just kind of like chip away a little bit at your reds, and then you throw them into the yellows. If I got a red correct and I knew that I really didn't know it, I'd throw it into my yellow pile. And so you have thousands of questions on there, but you can chip away different areas, and it was affordable. It was $40. And I used it actually I got it like my 3rd or 4th semester, but it was affordable to me, and I passed the Nclex right away the first time and felt completely confident with that app. and I also used ATI. Do you guys still, are you guys still doing that? Yeah, I went back, and for nursing school, I never once did an ATI quiz unless I was forced to. And I went back and did it, and was like punching myself in the face. I'm like, oh, I could use this the whole time. So I did take advantage of that because it was there, and that helped too. But that Nclex mastery, like if I was sitting at the gas station, I'd pull up my Nclex mastery. If like I was trying to cook dinner, my kids were driving me crazy, or if someone thought I was listening to them and I really wasn't, I was looking at my, it's really a great thing to have.
What was it like to register for Nclex?
Nerve-wracking. Date set, oh no, yeah, I don't know, it's just like stressful. It's just scared.
And it's a lot of waiting, you're waiting for your permission to test, you're waiting and then all of a sudden you get your permission to test, so you get on there and you have to apply for your license, you have to apply for your Nclex. So I'm sure they've talked about that, you got a couple $100 there that you gotta, it's like $100 for your license. How much was it?
It was $150 to start.
Was it?
But what happens is like if you get your license in February, you have to renew on your birthday. So I waited I waited to get my nursing license after I finished the Nclex, because my birthday was in March and I finished the Nclex in like January, February, and I actually waited to get my nursing license so I didn't have to pay again. So it all depends, like it kind of stinks. You can pass the Nclex in February, and if your birthday's the next couple months, you have to pay again for your nursing license once a year on your birthday.
And
So,
I actually did pay the twice
twice.
because I took it in July and my birthday's in September.
and you want to work.
But I mean, $100, you earn that pretty quickly when you're working as an RN, so it's worth doing.
So there is gonna be a class, right? Carol's gonna run a class where she'll talk more about registering for Nclex and registering for the license and when your transcripts go out, so that's something that she will clarify more for you.
I didn't realize you guys didn't have that yet. Just trust me. That's it
You
all.
won't
It's
feel
one
stressed
step at
once
a
you do
time.
that,
Yeah.
And you're all smiling and you're working, right?
Mhm.
So
I'm still working.
you're still
I'm working till 4.
So that is an advantage of home care, you can kind of switch up your times a little and make visits at a different time, so that is an advantage. Versus going into the hospital, but let's, so you talked about preparation for Nclex, you talked about select all that apply questions. Where did you go to take the test?
I went to Weathersfield.
Oh yeah, that's
Alright, yeah.
Okay, so Weathersfield,
You
okay.
can kind of, I know people that took it in Mass, just so they could test sooner. So, I mean, you have that option too, if you wanna drive a little bit further, to take it sooner. Because my recommendation is, unfortunately, what you know is what you know. I don't feel like, for me personally, there was no way I was gonna drag it out once, like certain people in my class. I was actually the first person in my class to take it. I wanted it done. I studied from the moment I graduated until I took the test, and then I was done. I don't feel that you studying for months and months after you graduated is gonna benefit you, because you guys already have the knowledge that, you've gotten along the way. So, to me, I feel like the sooner you take it, the better, the less stress too. Because the longer you drag it out, the more you're gonna be stressed about taking it.
So what is it like, you're going into a little cubby area, what are you going into? You know, because remember, even when we do our post-op teaching with patients, what do we tell them? We tell them what it's gonna be like, so tell them what it's gonna be
You literally
like.
can't have anything. You literally, everything, they make you put it in a locker, you get a little, like, whiteboard and a marker, I think that's all you get.
Yeah, they gave me headphones. We had headphones and like you were in like a cubby, like at the library here. Like
And they scan your palm veins. It's like Men in Black when they deleted his fingerprints. That's all I kept thinking of when they did it. So if you leave and go to the bathroom, you come back and they scan your palm veins again, make sure you're the same person.
There's a camera above your heads, so they're watching you closely.
But you're kind of like end up going in your own world. Like it's
Mhm.
kind of like you get nervous when you walk in there, and then like they put the earphones on you so you can't hear anything, and then it was like fine. You were just kind of like in it. Leading up to it was bad. Like I went to the parking lot like 6 hours early because I didn't want to be late. Because if you're late, you can't. And then I hid in my car, and then I fell asleep in my car, and then I like thought I was gonna throw up, and then I thought I should eat. And they're like, you should eat and go to the bathroom before you come in. But I couldn't do either of those things before I went in, so I thought I was gonna do awful. And they said wear comfortable shoes, which didn't make any sense. I thought I was doing everything wrong the whole time, but it worked out fine. Like just know that once you go in there, it's fine.
Do you guys have any other questions about Nclex?
How long was it after you graduated that you were actually able to take the Nclex exam?
I took mine as soon as I possibly could, and I think I took mine, I graduated the end of May, and I think it was the middle of July that I got my test date.
Mine was sooner than that. I think I took mine the end of January. I think I found out the beginning of January and was able to take mine like 2 weeks later, the end of January. And then I heard back pretty quick. Because I got my acceptance letter for my job like the first week of February. So, and you can still like be applying for jobs and interviewing while you're waiting for all this stuff. Like you could potentially have a job waiting for you the moment you pass with your score. I interviewed the day after, or 2 days after I graduated. I already had the interview set up before I even graduated, so if there's something you know you want to do, get a jump ahead.
I graduated in December, I passed my boards in January, so, you know.
We weren't able to get a spot until beginning of February of this year. So we graduated in December, and then at the beginning of February, like people start to get seated or to get their test.
Yeah, it was like a month, I think. You have to wait for them to send you an email to say, okay, now you can register. And then it's whatever you pick, like, I think there was 2 dates open, and then there was like 3 weeks from that, and I was like, nope, I stole like the first possible date that I could get, so.
And there's farther away locations, like someone did it sooner than me, I was one of the first, but they drove to Rhode Island or something, so you can do it sooner. And then I had some people that already had jobs pending the Nclex and didn't take like they were actually working.
Yeah, they can be hired.
Yeah, they were hired and
They have
actually
90
working,
days.
and then didn't take their Nclex till like March. So you can, if you're someone that takes a longer time or you're in no rush or you have lots of money and don't need to work, March.
Yeah, I mean, there was a student here one time, and he was accepted to the residency program, and it was gonna start in February, and some snowstorm came and whatever, so he ended up taking the test in Vermont, because that was the earliest open date that he wouldn't lose his job, but he wouldn't lose the residency program. Because some employers will keep you as a GN, but most won't. So, you know, it's like pending passing the Nclex, and therefore he drove to Vermont. Okay.
Is there like a list of certain states that you can go to, or you can take it anywhere?
Anywhere.
Yeah, anywhere.
Yeah.
It show, when you go to register for one, it'll show you like various locations and dates and times and all that kind of stuff,
Okay.
yeah.
You could take it in Hawaii.
Everybody-
Even if you're, so remember, Carol will tell you about your licensure, you're registering for your license in the state, but you can take your Nclex in any of the places they offer it. Any other questions about Nclex? And you may have more for Carol when that comes up, right? So now you have the chance to think about it. Why don't we move on to, you started to talk about employment. So when did you start looking for jobs? If you started at one job and moved to another, what were interviews like? You know, related to getting a job. How's that? What did you dress? What questions did you ask? When did you ask questions of how much money will I make? Was that the first question you ever asked? Okay, so those type of, why don't you talk about interview etiquette and how you got your foot in the door? We'll start this way. How about-
So I was already working at Nclex as a mental health worker, so I kind of had my interview before I took my Nclex. But I was also working closely with the nurses where I was at, so I kind of already had a foot in the door. And I work closely with the nurses on the inpatient unit, so they kind of had already like advocated for me to work. So my interview, I can't really say was like, I don't know, I was wearing what I wore to work that day. They kind of like set me up and just said, here, go in this room, and the supervisor that's gonna hire you is gonna come in and talk to you. It was like a formality thing, really, just to fill out paperwork. But like I said, I had already worked there. And then I just transitioned right over as soon as I passed my boards, and I started 2 weeks later. So mine was a little bit different, I guess, than maybe some others.
But again, some of you may be in positions where you're already working in a facility that you think you want to be the RN in too, so something to.
I applied for a job in July, beginning of July. I had just had a baby. So when I applied at the beginning of the July, and then mid-July I got an interview. One of our instructors helped out too. I called her. She knew the group of the preceptors at the hospital that I'm working. And then I just got an interview after that. I heard from them a week later, and I started at the end of August. Now, the questions that they were asking was basically like our experiences, what we went through, like nursing school, what was more valuable, our strengths, our weaknesses, and things that were not in my resume. So that was kind of like, took me off guard because I wasn't really expecting that one. Dressing, business casual, and don't ever talk bad about anybody, anywhere you go, and that's pretty much it. Like,
My experience is a little bit different too, because I've worked for the state for, over 7 years. I started as an LPN, and then when I got my RN, I applied and interviewed and took a promotion. So I've been doing that for 2 years. I have interviewed elsewhere, so I do per diem work too in long term, but a lot of the questions are the same no matter which job you go to. Some are easier to answer, some of them are a little bit more difficult. I think before interviews I've looked up some of the tougher questions that people might ask you in an interview, just so you're not sitting there staring at them and say, I don't know what to say to you. One of my most difficult questions is when somebody asks you, like, what's something people, a negative thing about you or something along that lines. You want to say something that's not going to make you look like you don't know what you're doing, but you don't want to seem like you're talking like you have no downfalls. I always ask the person that's asking me for an interview what I should wear. If they want you to dress in scrubs, or they want you to dress in business casual, usually you can ask that kind of thing. That's my experience.
For me, I started when I was, I won't bore you with all the details, but when I was 12 years old is when I decided I was going to be a flight nurse, and I'm very, when it comes to what I want, I'm very, I'm always on track. I try not to derail, and I try to, find whoever it is that I need to talk to make sure that I stay on the right track and that I don't derail. So what happened is I wound up talking with one of the flight nurses who was sort of a mentor to me, and I started my career after high school in EMS, so for years I've been a paramedic full-time. I put myself through nursing school, knowing the entire time that that's what I was going to do. I was going to be a flight nurse. And the requirements were such that this is what worked for me, and so once I finished nursing school, I knew that I wanted to work at Harvard Hospital. I wanted to be at a tertiary care center. Not so much the ED experience, they wanted the critical care experience, and so I worked in the open heart unit for about 4 years. But I've had my paramedic experience because you have to have both to fly. And then I sort of had, mentors throughout the entire process. and when they called me to say that I got the job after I interviewed, they said, look, you went through every hoop that we asked of you. And so the interview process was very intense, but it's made to be that way, because fact of the matter is, you're in a critical care, you're flying essential department hospital, so you are part of the critical care unit. We carry all the bells and whistles that they carry in the ICU, just smaller. And when we land on a scene and you have a 6-month-old that needs an airway and everyone's frantic, if you lose control, then the entire scene loses control. So we're essentially trained to a 3rd-year resident. We don't fly with doctors, we're very autonomous, we do everything on our own. So yeah, so was it intense? It was very intense, but it's made to be that way, because if you are gonna crack during an interview, then chances are you're gonna crack when you're out there, and that's not the time, place to crack. So I went around, the table was, I just remember a very long table. I can tell you exactly what I was wearing. I can't tell you what I was doing yesterday, but I can certainly tell you that day. And when I went in, it was the chief medical director, there was the chief pilot, the couple crew members, there's probably 15 people, and they just fired questions at you. They just went around the table, just fired questions. There were some scenarios, but mostly it was more about logistics and but they gave you scenarios, they slid you over a piece of paper and a pen, and they said, you have a 2-month-old severe burn scene patient, calculate your formulas and everything that you're gonna do for this baby and where you're gonna take them. And then after the second part, at that time I came back, I think it might have even been the next day, it was so long ago, but I came back and we went to a simulation center, and the doctors, they all stand behind a window and they watch, they give you 3 or 4 different scenarios, and they watch and see how you handle it. That was my experience in my interviews.
So the great thing about nursing is if you don't find an area you really love in nursing school, there's so many areas of nursing you can go into, so literally anybody can go into anything that they're really good at. And I knew right away that the hospital was absolutely not for me, to the point where I didn't even want to do nursing school anymore. So I started exploring other things, and I did some medical missions in other countries, and I kind of got a taste of what it was like to actually take care of people in their own environment. And I didn't realize that's what I was doing at the time, that was holistic care for me. And then they started the rotation with VNA, and so that's when I got to put that passion that I had. I had done 4 medical missions, and I got to put that passion that I had doing these home care visits in other countries, and barrios and bates, and I got to take it and kind of place that here. And I've been into houses in the nicest areas you can imagine that have dirt floors, and I've seen everything, and you get a little bit of social work, and we see everything. I hear all the time that you shouldn't go into home care right out of nursing school because you're going to lose your skills. I guarantee you that you're going to get to do more than you ever thought you would be able to. I do wound vacs, I drain lungs, I take care of cancer patients, I take care of everything that you see in the hospital, but I get to take care of them in a place where they're safe. So they're all 99% of the time gracious and happy that I'm there, because I'm in their safe place helping them. I'm coming into their world, and they're inviting me in there. So it's really wonderful, and the training that I've gotten has just been immense and very focused on answering my questions and supporting me. I work in an environment where if I'm scared at any point, or I need any kind of support or any question, I'm safe to call a supervisor, and I don't ever feel like I'm stupid. I always feel like I'm out the other end learning. And I knew I wanted to do it right away, and I started getting letters of recommendation in November, and I applied as soon as I was able to, the beginning of December, and I already had that job interview. So if there's something you're passionate about and you already know that that's what you want to do, then go for it. And you don't need to listen to other people telling you that you need to keep up on your skills and you have to go do a year here. I have friends that are doing did their same first year in a hospital that I did, and we were doing the same things. And I was actually getting to do things that they had specialists for in the hospital, and I was getting to do them in front of me. So the only difference is at the end of their shift, they turn off their phone and go home and they're done with work until they get called back in. And with home care, you really, it's harder to find that line between home and what you do, and so you have to really, really, really love it, and you're kind of a nurse all the time, which is nice too. But go with what you love, and if you don't find something you love right away, you're going to find something that you love, because there's so many areas you can go.
Alright, so kind of the flip side to Sarah is I knew I wanted to be in the hospital and I knew I wanted to be in the emergency room. Second semester I got a job as an ED tech at Wyndham Hospital. And I knew I wanted to do the nurse residency program when I had found out about that, so I kind of did a lot of networking, like I'd find out who was in, like, you're meeting people all the time when you're in the hospital, and so, oh, you're part of the nurse residency program, and I'd introduce myself and just try to remember the space kind of thing. And so then I was kind of stalking the Harvard Healthcare website, waiting for the nurse residency application to open, which it is open now for you guys too, FYI. I'm still stalking it. So that was kind of how I got my foot in the door with that. And as far as interviews go, when I interviewed as a tech, it was a lot like what was mentioned before with the whole, what are your greatest strengths, what are your greatest weaknesses, have a bunch of stories in your back pocket to pull out. But because I had my foot already in the door, when I did apply for the nurse residency program, I was able to just kind of slide in there and I didn't have the formal interview.
And some of the interviews you've had have been with single people and others have been with panels, correct? Right. So you have to be prepared to go into a room with a panel. And let's say, for instance, they might not ask you all medical scenarios, right? They might ask you, so if I opened your sock drawer, what would I find? Would I find all the socks put together, or would I find them all scattered? Be truthful, be honest about that type of question, because in that sense, it goes a little to your personality. So your personality, the emergency department nurse, has the socks that are not put together, is that true? No. Yeah, some. She has too many kids to not be. That critical care nurse is very precise. So has a great personality, but very precise. They're Sue looking. Her peacock feathers going up. Sitting next to Cindy.
We love things in order.
Our socks are
You
not
never
bad.
knew that about me, right?
All right, so again, you're thinking not only of medical and nursing, and how would you approach a family? A family is coming up to you and they want this, this, and this. What would you do? All right, so that type of thing. I will share quickly, Richard, at this point I don't think is coming, but I'm just going to share his story a little because I do want you to remember long-term care. All right, so Richard was a carpenter, all right, and decided to become a nurse. And he came into nursing, and he went into long-term care. That's where he started his career, in long-term care. And he worked very hard, he applied himself very much, and they recognized that. There's somebody with a work ethic, all right? They're looking for work ethic too. And, you show up, you speak respectfully, you give customer service. So then they offered him, we'll train you, we'll send you back to school and you can become the wound care nurse for this institution. And he did that, and he thrived in that. And then in the next iteration, staying in that same facility, he became the assistant director of nursing. All right, and again, so moving into management. That was, not everybody has to move into different management areas. You may love being that direct care nurse. Stay there if that's your love. All right, sometimes we always push people to the next level and the next level. If direct care is where you want to be, direct care is where you want to be. okay? So, but he enjoyed the assistant director, and then he decided, I'm going back to school, and he actually, that was part of it, he was debating, like, if it snows, if Hartford is closed tonight, I'll definitely be there, but if I have to arrange for staff, because now he's the director of nursing, all right, in a long-term care facility. So, you know, everybody's gonna find their own path and find where they're happy and be respected for each nurse that you are. So, going back to this world, if some of the questions they were asking, they wanted pointers for now they've gotten their job, right? Oh, okay, so how long did you have to wait to hear about your interview? How long did, I know some of you are different because you did the slide routine, but how long did you have to wait?
I kept bugging them. I wanted the job so badly, and so I would call probably once a week and say, hey, is there anything else you need from me? And don't forget about me. And I was left, they never hung up on me. So for me, it actually took a few weeks. And what happened with me, which kind of stunk, is they were only going to take one nursing student to try this out, see if it worked. We were the first nursing students they ever hired, as far as I know, like from this program. So I was actually interviewing against another really lovely, amazing human being that I was graduating against, and I was graduating with her, and then I was also against her in these interviews, and she was totally different than me, like total opposite end of the spectrum kind of personality. So I was like, oh my gosh, like, and I thought she was wonderful. So I was like, oh, they're totally gonna pick her, and in the end, what happened was they couldn't decide, so they got approval to get both of us. We're both still there now, 3 years later, and she's just amazing. But I really had to push. I did not hear back right away. They did not know that they wanted me right away, and so I really had to let them know that I was passionate and wanted it and was willing to do anything, you know. So I think it's really important when you interview for a job that they know how badly, you know, you're interested in that, how passionate you are, how interested you are in that area, and that you want to learn. And a great thing that I kind of used, and it turned out that it worked for them, was I was like, I'm a blank slate. You don't have to erase any bad habits. Like, I don't know anything. And now they actually will say that. They're like, it's really wonderful when we get these new nurses because we can teach them the way that we want them to do things. So it's actually worked out.
So do notice that she said, I called them once a week, not every day. Okay? You don't want to be a stalker, right?
No, and if you have an email, you know, they say you should follow up thinking for the email, and I mean, you have to remember they're super busy too, so like, it may not be a priority if they don't need someone right away to call you right away. They may be interviewing other people. They may just be putting out fires at work, and it's not a priority to call you at that point. So you don't want to annoy them or stress them out at the same time.
But notice that whole, you want to say thank you, right? Thank you for the interview.
And the opportunity.
The opportunity.
Yeah.
Okay. All right, any other questions related to getting hired that you'd like to ask, Zach?
So with the Bacchus residency, it feels like it's mostly online. How did you find like contact information to follow up?
Yeah, mostly online, because so they have a few information sessions. I ended up going to one of the information sessions. I'm not sure when they are for this time. But I went to an information session, and they had the nurse educator for the emergency room, they had the nurse educator for psych, they had the nurse educator for med-surg, and they kind of just like did a preliminary interview while you were sitting there, just wanted to know why you wanted to do the residency program. And so I had met with the nurse educator for the emergency room, and so then I had her name, so then I just kind of looked it up on the Hartford Healthcare website, used my FBI stalker skills.
Buy a phone book?
What?
Buy a phone book?
Yeah. And then I, found her name on there and just emailed her from there.
Okay.
Any other questions? Interviewing, getting that job?
Cover tattoos and take out your piercings.
Okay.
I'm tattooed all over, because they get to know you. I mean, everybody has policies, and my job does not have a policy, but know your audience, and so they don't know you. So everybody, whether they're supposed to have preconceived notions or judgments or not, it's just kind of a respect thing, I guess.
So for the home care, do you follow somebody, do you have like a mentor or something like that?
Initially,
Yeah.
they have a great orientation program, just like you go anywhere else in the in the hospital, you have the orientation program. Ours is about 6 months. And if you need more time, they give it to you. And if you want to fly, they kind of give you a little rope as you want to go off. It's really, it's great. It's kind of gauges based on how confident and how good you're feeling about it, and how quickly you're picking things up, because it can be very hard and overwhelming. Some people need more time, and they're so accommodating about it.
Did all of you have an orientation program?
I'd like to just speak a little bit about,
Okay.
so with my job, our interview process is extremely extensive, because with background checks, drug screening and everything, we work in a correctional facility. So the process of getting hired is a lot more, it takes a lot more time than in a lot of other settings, because you have to be cleared through so many things. Our orientation is extensive. We actually go through the academy like the officers do as well. We get trained in restraints, chemical agents, everything, inmate contact, everything. Our setting is so different than any other setting that we try to prepare you with that through our orientation. Our interview process is also very extensive. The type of questions they ask you, they put you in situations where you need to understand safety and security of a facility, as well as understand mental health and medical, and know that safety and security is always priority over those things. And it's very hard as a nurse to not try to rush into a situation, which is similar to a paramedic, where they're observing the scene before they walk into it. Police are usually there or whatnot to make sure something's safe before you enter. So it's a lot different. It's a lot more
Jamie, is there anything different behavioral health-wise too?
Very similar. It's, like, I can't tell you the last time I wore a stethoscope around my neck or in my pocket.